Medical debt is a huge problem in our nation. According to Estes and et al., affordable care in the U.S. is deteriorating, and that is an understatement, to say the least. Imagine having survived cancer or a traumatic health event that required aggressive treatments. You are now in remission, cancer-free, and then the bills start to pile up. You now owe thousands and thousands of dollars in out-of-pocket expenses. If gone ignored, the phone calls from doctors' offices start, and then eventually creditors start calling all day and all night. For too many Americans, this exact scenario is their reality. Let's look at a few shocking statistics. Since the Affordable Care Act was enacted, access to care has increased, but yet that care comes at a price that some simply cannot afford. According to a survey conducted by Kaiser Health in 2017, nearly 1 in 5 Americans, or 42.9 million, are crippled with medical debt. Nearly half of bankruptcy cases are directly related to medical debt. And notwithstanding any medical emergencies, the average individual reportedly spends $1,120 in out-of-pocket expenses yearly, a 17% increase from 2009. Medical debt has improved slightly, but yet more work needs to be done. As compared to 2011 statistics, the number of individuals younger than 65 years old with medical debt has decreased by 5% in 2017. It is estimated that targeted efforts of the Affordable Care Act and other initiatives for efficient and effective delivery of care will help reduce healthcare spending by $590 billion and, quote, help lower premiums by nearly $2,000 per family, according to Estes and et al. As you can see in this graph, currently the U.S. government spends more than $10,000 per person, which is higher than any industrialized nation in the world. So what has been done to improve this issue? To understand the 5% decrease in medical debt from 2011 to 2017 is to know the breakdown of the causes of medical debt. In 2011, roughly 28% of those struggling with medical debt had no insurance. However, since the passing of the Affordable Care Act, more and more Americans are mandated to obtain insurance or face a penalty. As more people are covered, medical debt decreased slightly. Thus, it would seem fair to conclude that some insurance is better than no insurance. Numbers remain elevated, though, due to other factors, such as high co-payments, premiums, coinsurance, and costly prescription medications. Thus, in order to decrease costs, we have to decrease the cost of healthcare altogether. What has not worked? Notably, in recent years, debt collecting agencies have made a fortune on the misfortunes of others. Collecting debt on credit card bill is one thing, but collecting money from individuals who become sick is adding insult to injury. Individuals should not be forced to fork out their life savings to pay for something that insurance should have covered in the first place. What further aggravates the issue is that once the debt collecting agency buys off the debt, at a huge discount mind you, they still harass the consumer for the entirety of the debt. That is an American tragedy. So the question remains, with medical debt so high, are people actually seeking care? Sadly, no. 1 in 10 people delay medical care simply because they are afraid of incurring more debt. Medical debt also causes individuals to alter their lifestyles significantly, as they put off vacations, cut back on groceries, and even incur more debt by borrowing from family, friends, and even increase their credit card usage. Medical debt is out of control, and it's time for Congress to institute stricter national and state policies to combat this issue. This is important because, as Radley and et al. Pointed out, states that, and I quote, had been the focus of national as well as state policy and attention, end quote, outperformed the ones that did not. I do implore you for the work that has been done so far. For example, as of 2017, individuals have a grace period of about 180 days to settle bills before it gets in the hands of credit agencies. However, more change is warranted, so therefore I propose Congress to consider a cap on outstanding medical bills based on the individual's income and other hardships. Second, make it illegal for credit agencies to double dip on profits, that is, collecting full amount on debts owed after they have already purchased the debt at a substantial discount. Third, I am also requesting that, just like retirement plans, that flexible spending accounts are matched by employers, as this will create an incentive for all employees to save for expected expenses such as co-payments, prescriptions, and etc. So it's time to cut the American people a break and a better, fair deal in regards to healthcare. Let's make it happen. Thank you very much for your time.